Right. So the selection in localized prostate cancer is the magic word. Until now, we had a dichotomy between active surveillance and more radical options such as surgery or radiotherapy. And nowadays, we can hyper-select these patients that have the clear indications for what we call focal therapy. That is no other thing than a partial gland ablation that aims to tackle on the index lesion that is depicted by multiparametric MRI. And by that, we will control the disease without burning bridges, meaning that we could eventually go for salvage treatment if that becomes necessary, but the patient will keep up his quality of life. That's pretty much the idea of focal therapy. There are a number of variables that need to be taken into account. So the patients need to be have a specific Gleason score. In the oncological selection, initially there was a lot of low risk prostate cancer treated with focal therapy, which we know is not ideal. This is Gleason 3+3, but nowadays it should be Gleason 3+4 and 4+3. There is we work in a world consensus that's going to be published this year, the Falcon consensus, that is putting out of the number of variables. So there are functional variables, there are prostate variables, and there are patient variables. So that means that we aim to treat cancer without compromising the functional outcomes. And that by doing this, we need to think about age, baseline function in terms of potency and incontinence. We need to define how's the disease. Is it bilateral disease? Is it unilateral disease? Where is the index lesion that is depicted with multiparametric MRI located within the prostate? Is there any disease elsewhere? So metastatic workup is important. We need to understand, make the patient understand that there is a possibility of recurrence and how this recurrence can be addressed if they ever happen. So it's an extensive discussion, and hyper selection is mandatory, especially at the beginning, to create solid bases to eventually move forward and push the envelope towards a more aggressive treatment of the disease with focal therapy.